Honorable Chairperson, respected panelists, respected judges, and dear learned audience, Assalamu alaikum and a very good afternoon. I'm Dr. Abida Tasnim Reza, Assistant Consultant, Evercare Hospital, Dhaka. Welcome you all on my presentation. I'm going to present a case which presented with pericardial effusion. So my case is a 57-year-old male, non-hypertensive and ex-smoker, presented with shortness of breath for 3 days, and it aggravated suddenly, and there was no history of cough, fever, or chest pain. On examination, his vitals were within normal limit, saturation was maintaining, and on auscultation, the heart sounds were muffled, lungs had some basal crypts in bilaterally. So this is his ECG, and it shows that there was low voltage ECG. Chest X-ray, AP view showing there is enlarged cardiac shadow. We did some investigation panels, and we found out that CRP is little raised, NT-proBNP is little raised. So we did a bedside echocardiography, and we found out that there was a large pericardial effusion, and there is also in the parasternal long axis view, we can appreciate that there is diastolic collapse of the right ventricle. So in this view, appreciate that the swinging heart, that is, there is large pericardial effusion, and there is diastolic collapse of the right ventricle as well as the RA collapse in the systole. So this was a case of cardiac tamponade, and we immediately, this is the picture showing that there is RV collapse in the M mode. So we immediately took the patient to the cath lab, and we did fluoroscopy guided pericardiocentesis immediately. And the fluid was hemorrhagic. So afterwards, we did the analysis of the pericardial fluid, and it found out to be exudative. There was no malignant cells in the pericardial fluid analysis, and also we did all the tuberculosis panel, but all came out to be negative. So with the pigtail kept in situ, we did echocardiography, and even after drainage of 1.5 liter ml, 5 liter fluid, we found out that he still was breathless, and his pericardial effusion was moderate. So we continued to drain, but even after 5 days keeping the pigtail in situ, his effusion did not improve. So
Abida, what was your diagnosis?
Actually, madam, our diagnosis was that patient had cardiac tamponade. That is the echocardiographic diagnosis.
Tamponade is like saying
No.
anemia or
No, he
jaundice.
did not. Yes, he did not
Tell
have
us-
any anemia.
Tell us malignancy, tuberculosis, or
Okay,
what?
yes, madam. That was the dilemma we had. Actually, the patient had only shortness of breath and very short period
No,
of time.
no, no. Tell us the diagnosis.
Okay, so the diagnosis was that we did a CT scan, and we found out that there was mediastinal lymphadenopathy. So after that, we biopsy of the lymph node. It was the metastatic adenocarcinoma of lung origin.
And what were the types when you...
Yes, it was, the cell count was, predominantly there was lymphocytic cell count analysis, and it was also exudative. So the things like tuberculosis panel, connective tissue panel, but nothing came out. Malignant tissue also came out negative. And consolidation, nothing, just the enlarged cardiac in basal area of the lungs, but nothing else. So it was really unusual to find a cardiac tamponade patient presenting a lung carcinoma patient. Just first presentation was cardiac tamponade. No history of cough, no history of fever,
No,
history of
that
weight
is
loss.
all right.
Yes.
What we want to know is what was your final diagnosis and how you treated.
Yes.
That's
So
all.
yes, the final diagnosis was metastatic adenocarcinoma of lung. Primary origin was lung, so we refer him to oncologist, and we started the anti-cancer, oral anti-cancer therapy. Yes.
Okay, malignancy.
Yes, madam.
In the echo itself, you could have told. Do you know why?
Madam,
If it was tuberculous, you see the fibrous
Yeah,
bands moving.
fibrin
That
threads.
is not
Yes,
there.
yes,
The
madam.
tamponade can occur only in two. One is malignancy and other one is the tuberculosis.
Yes,
And
madam.
what other peculiar thing that you see in the echo?
Madam, actually during echo, we found out that there was some,
But here there was a RV collapse.
yes,
A very severe form.